All right. Hello, everybody, and welcome to today's presentation, which is called Improving Child Health Outcomes. We'll be focusing on both physical health and mental health, with more focus directed toward mental health interventions and how families and parents can work to improve their own mental health and their children's mental health. Today's presentation is for parents and caretakers. It's probably the most useful for parents and caretakers of younger children because these interventions are especially effective when you get started with children early. But I do think regardless of your child's age, you should be able to find something useful here. Okay, so why am I here? You might be asking yourself that and wondering how this presentation impacts you. Why is it for you? You might be here because you have a child who's experiencing anxiety or depression or maybe some social withdrawal or isolation. We call these internalizing behaviors. You might be here because your child is acting out or behaving kind of aggressively. We call these externalizing behaviors. You might be here because your family is going through a period of transition, such as divorce or remarriage, potentially, maybe unfortunately, because you've lost someone recently. You might be here because you're concerned about your child's health today and in later life. Or you could be here because you want to learn more about improving your children's health in general. All of these are great reasons to be present for today's presentation. And no matter what your core reason is, hopefully you'll be able to find something here that can help you. Okay, let's get the bad news out of the way first. I'm going to tell you some things that you might already know or have assumed. The first of which is that some families do unfortunately face a higher risk for negative life events and kind of adverse family circumstances. As we know, unfortunately, there are higher rates of incarceration among minority families. And historically, same-sex couples do face higher rates of discrimination. So we're going to keep that in mind as we go forward, that some of these events do unfortunately apply more to other populations than others. It doesn't mean a hopeless situation, but it is something to be aware of. We do know that family stress has an impact on children. Family stress, we know, activates cardiovascular arousal. It activates inflammatory and immune responses. These different responses do undermine health for children, and they unfortunately do have the potential to increase the rate of chronic disease risk as children age. We do unfortunately also know that instances of youth depressive symptoms and suicidal thoughts and behaviors are on the rise. Approximately, as of 2020, 21% of children from the age of 2 to 17 have some kind of diagnosed behavioral or psychological condition. And we are seeing that these rates are increasing. In terms of kind of physical health outcomes, we do know that rates of childhood obesity, asthma, bronchitis, and hay fever are also rising. So it's important to keep these different factors in mind, that family stress is impactful, but some families are at a higher risk for certain stressful events in their lives, and that both mental health and physical health, sort of unfortunate outcomes, are rising for children, and these effects can impact them later on. So with all of this in mind, what impacts a child's health? What kind of family situations, stressors, dynamics? In general, we know that family instability, periods of strain and disruption do impact a child's health. This can mean going through a divorce. It can mean starting to live with a new partner. It can mean certain financial situations. And we know that transitions, especially the loss of a parent through instances like death, incarceration, and military separation do impact a child. Death can increase health and mortality risk for children, even into their mid and later lives. Incarceration definitely increases children's stress, which is not good for their health. And military separation is also linked with certain health outcomes. Divorce and parents-strained relationships in general are linked with some health outcomes. Okay, so what other things impact a child's health? We have domestic abuse and domestic violence. Children whose parents engage in domestic abuse do have higher rates of cortisol reactivity, which is the stress hormone, and report higher rates of asthma. We have child neglect and abuse. Child neglect and abuse are known to activate certain biosocial processes that can lead to that can take a lasting toll on children's health. We know that spanking and other forms of physical discipline are also linked with long and short-term health effects on children. So these are definitely things to avoid. Lower socioeconomic status, which is linked with higher rates of stressed and distressed parents and caregivers, chaotic family routines, conflict and instability, which do have outcomes for children's health. And as well, parents' poor health, especially drinking. There are patterns that we can see that when parents drink, adolescents engage in more kind of acting out behaviors, more externalizing behaviors, as we would call them, which could then lead to parents drinking more. And so the cycle sort of continues. You might be hearing about some of these instances, especially health or socioeconomic status, and thinking, okay, well, I can't control this. It's not my fault that my health isn't amazing or that my economic reality is what it is. And, you're definitely right. None of this should be taken as a personal attack. And of course, there are certain things about our life situations or our parenting situations and family situations that we cannot control. And none of this is meant to shame anyone based on their economic situation. It's more just something to be aware of as we think about health outcomes and what we can do to mediate some of that. Okay, so moving away from sort of the some doom and gloom and into what you can actually do and where to get started. Certain things are really helpful for children, such as maintaining stability in the home as best as you can, finding routines, minimizing physical punishment, staying healthy, pursuing close relationships, and seeking out financial stability when possible. In terms of staying healthy and pursuing close relationships, what's great about this is that there are a lot of things that you can do together. I remember when I was a kid and feeling really stressed out about school or about my social life or just about, growing up and feeling lots of different types of angst. My dad and I would go play tennis together, or he would coach me in volleyball, and we would just spend time outside, getting our heart rates up. And it was a really good way for us to both bond and pursuing close relationships is really good for children. A close and cohesive family system is very protective for kids, especially when kids are at higher risk for discrimination because of their sexual orientation, their gender identity, their immigrant status. And maintaining these close relationships with the whole family, sibling relationships can be really protective for kids if they're nurtured, and if there is that family system that supports that. And seeking out financial stability when possible. Family stability can do a lot to mitigate or lessen some of the effects of stress on children and can help them in terms of their mental and physical health beyond childhood. So thinking about other things that you can do to improve your child's health, specifically their mental and emotional health in this case, we have emotional socialization parenting interventions, which is a very long phrase that when we break it down, it gets a lot simpler to digest. So parenting practices or parenting interventions like these utilize things like emotion coaching. Emotion coaching involves validating and labeling a child's emotions. This is a philosophy that parents can engage in to positively socialize their child's emotional regulation. They can do this by being aware of their child's emotions, aware of their own emotions. They can view emotions as a time to connect with their children and to teach them about emotions, and help children to become more aware, and in that process support them as they work to get through a negative emotion. And this can be really beneficial later in life. Parents who engage with emotion, so yeah, there's emotion coaching. There's also the development of emotional regulation, and the processes of emotional competence. So this can involve things like learning what different emotions are, emotion knowledge, learning how to express emotions appropriately, and being able to show that to your children. So yeah, parents, emotion socialization, parenting interventions such as emotion coaching can help improve parents' emotional competence. It can help improve their reactions to their children's emotions. It can help them improve their ability to help children understand and control their emotions. These interventions are found to be really helpful in terms of parents' emotional regulation, the family's sort of emotional climate or their emotional reality, children's behavior, and children's emotional abilities. Okay, yeah, so going on with emotional socialization parenting interventions, or things kind of like emotion coaching, helping children regulate their emotions, becoming aware of emotions, researchers have found that emotional socialization parenting interventions are even more helpful if children have clinical symptoms. This means that a child might have depression or hyperactivity, aggression, or acting out. And this is relevant because, as I've already said, approximately 21% of children from 2 to 17 have some kind of diagnosed behavioral or psychological condition. These kind of interventions can potentially help parents and caregivers prevent and treat depression and ADHD. And yeah, in general, helping parents regulate their emotions helps children. And as we know, stress has negative effects on children in terms of their physical and mental health, both in the short and long term. Being able to utilize these interventions and approaches can really do wonders for your child's health in the long term. So just a few other parent and family focused interventions before we wrap up. Psychoeducation is basically just what it sounds like. It's a type of mental health treatment that tries to give individuals and families accurate and effective, kind of all-encompassing information about mental health conditions, the brain, behavior, symptoms, treatment options. It's really just education about the psychological, emotional health sort of world. Counseling with psychoeducation, so counseling that specifically incorporates those kind of elements. And then trauma-focused cognitive behavioral therapy, or CBT. CBT is a really popular form of therapy. It's a type of psychotherapy that essentially wants to change certain not ideal thoughts and behaviors with the goal of improving a client's mental health overall. All of these are found to lead to positive outcomes in families and children, such as youth mental health and well-being, parenting behaviors, and family functioning. Okay, so just to wrap everything up, here's what we know. We know that youth health can affect later in life health. So what children experience early on in their lives can impact them as adults. We know that many mental health disorders begin in childhood, youth, adolescence, and they can remain throughout the lifetime and have negative effects in terms of well-being and functioning. But the situation is not hopeless. You can help your children by helping yourselves. Emotion coaching, psychoeducation, and counseling can do a great deal in terms of improving a child's mental health, lessening their stress, and leading better short and long-term outcomes for them. And it's never too late to get started. Hopefully this presentation was helpful for you as you begin or continue or work to reinvigorate your journey on caring for your children and improving their health in the most effective and comprehensive ways possible. Thank you so much for listening, and I hope you have a great day.